All right. Hello, everyone, and welcome to Planning for Future Care. My name is Kristen Osterhout, and I am the Education Coordinator for the Alzheimer's Disease Caregiver Support Initiative. I do have a couple of housekeeping notes before we get started. So you are all in a listen-only mode, which means I cannot see or hear you. However, if you have questions, please type them into the chat box. I'd be happy to answer them either throughout the presentation or at the end if we have time. I also want to share with you a little bit more about our program here. So we have a grant from the New York State Department of Health to provide services for caregivers in 6 counties, and they are Clinton, Franklin, Essex, Warren, Washington, and Hamilton counties up in northeastern New York. And we do that through education and training, like our presentation today. We also have an online training called CARES that is free. All of our services are free, actually. We do care consultations, which are one-on-one meetings with you and one of our care navigators, or with your family and one of our care navigators, to talk about your individual situation, to link you to our services and then other community organizations as well. We have support groups and memory cafes. Right now, both of those are happening virtually, but some of the support groups are going to start being offered in person in October, which is very exciting. And we also have respite. So we will pay for caregivers to get a little bit of a break. And we do have something called Project Lifesaver, which is a bracelet for your loved one to wear. And if they were to wander, this would help locate them very quickly. So that's me, and that's our program. And we have a little bit of a longer presentation tonight with the Planning for Future Care, but it's such an important topic. So I want to start out by just saying that you're not alone. Today, it's estimated that 67 million Americans are providing care for a loved one, and that number is expected to grow as the baby boomer generation ages. So it's really important to start talking to your family now about what aging with dignity means to you. We all want to age with dignity and choice, and especially in situations where dementia is involved. You need to have that conversation early on with your loved one about what their wishes are for the future, and think about what your personal wishes are for the future now. It's never too early to start that conversation. Different people are going to need different kinds of support. As people age, they tend to need more help with some things that you and I may take for granted, such as getting out of bed, walking, preparing meals for themselves, eating, bathing, showering. They may need help with activities of daily living. And support that the family gives counts. A lot of times people don't think of that. They just think that they're, fulfilling their familial obligation. It's what it's expected to me. I'm not a caregiver. I'm a daughter, or I'm a son, or I'm a spouse. But family members really are the backbone of caregiving. Usually family members will help out in 3 different ways, either with hands-on care, with financial support, or with emotional support. And all of this will allow your family members to stay in their homes longer. Long-term care is expensive. I need to update the statistic I have, but my statistic is from 2011, so 10 years ago. And the average cost back then of a semi-private nursing home bed was $78,000 for a year. The average cost for a part-time aide in the home was $22,000 for the year. And those numbers, I'm sure, have grown more expensive. A big misconception is that Medicare will pay. It does not pay for long-term care. It will only pay for short-term rehab stays. So we're going to talk about what some of your other options are for the future. And don't wait for an emergency to talk to your loved one about what their wishes are. Start talking about what their plans are for the future now. Build a circle of support. Talk to their doctor as well, and find out who your loved one's healthcare proxy is, who's going to be making their important medical decisions for them and other important decisions for them. We all want to age with dignity, choice, and independence. I think that's so important. So in order to do that, you need to have that conversation and find out what gives your loved one a feeling of a fulfilling life, and think about what that means for you too. So planning ahead for doctor's visits, it seems like now we only get a few precious minutes to talk to your doctor. So make a list of questions or concerns you might have. If it makes sense, include the person that you're caring for in that conversation as well. Ask them how you can be helpful during the visit and what type of questions they might have for the doctor. If there are other caregivers in the situation too, maybe, it's a group of siblings that are caring for a loved one together, find out what questions or concerns they have as well. Bring a list of all the medications your loved one's currently taking, and be sure to include over-the-counter medications, any supplements, vitamins, things like that. Make sure you know the doses and how often your loved one is taking them as well. This is especially important if your loved one's seeing more than one doctor. It can be easy as the caregiver to answer all of the questions and really be the leader for that conversation with the doctor. However, if possible, allow your loved one to do as much of the talking as they can. And if possible, respect your loved one's privacy, leave the room if they need to while they're with the doctor. If you live out of town, talk to the doctor about how you can stay up to date on your loved one's health, and ask about community resources. A lot of practices may have a social worker or someone that you can talk to find out more about other community resources, or sometimes it's the doctor themselves that you can ask those questions of. So planning ahead for hospital stays, there's two different types of hospital stays, either a planned stay or in an emergency. So I'm going to start just by talking about what to do in an emergency. For a person with dementia, this can be even more scary than you or I. No one loves going to the emergency room. And so by having a plan ahead of time and using some of these tips can help make the visit a little bit less stressful. If possible, bring an extra family member or friend, preferably someone who the person with dementia knows and is comfortable with. This person can sit with your loved one and talk to them while you talk to the doctors. Be ready to answer questions from the hospital staff, and you may have to answer the same question multiple times, which can be kind of frustrating. And also be prepared to kind of talk to the ER staff about the dementia that your loved one has, and have to do a little bit of educating on them. Sometimes ER staff is not very well trained on working with people with dementia, so you may need to explain the best way for them to talk to your loved one. Comfort the person you're there with, comfort your loved one or the person living with dementia. Try to stay as calm and as positive as you can, and that will help keep your loved one calm. Be patient. Depending on how busy the ER is and what type of emergency you have will depend on your wait time. Lab work doesn't always come back right away. And just because you don't see staff working doesn't mean they aren't working behind the scenes. It's very important not to leave the emergency room without a plan. If your loved one isn't admitted, make sure you understand whatever the follow-up care instructions are. And if your loved one does stay overnight, try to have someone stay with them. It can be helpful to have an emergency bag packed and ready to go so you can grab it and head out the door when you need it. In that bag, you may want to include your insurance cards, a list of medications and medical conditions, list of doctors, your loved one's healthcare advance directives, snacks and a bottle of water, even for yourself, depends if more, any kind of comfort item like your loved one's favorite sweater or blanket or slippers, whatever's going to make them feel comfortable. a change of clothes, toiletries, and your medications, as well as some pain medications. The worst thing is to be in the hospital and have a headache and not have any Tylenol to take for your headache. Have a paper and pen to take notes and some cash, that way you can go to the vending machine or to the dining hall. Now, in a planned stay, you'll have a little more time to be organized. And it's important to realize that a lot of times a person living with dementia will need to go into a hospital at some point. So when a hospital stay is coming up, planning ahead can help make it go smoother. First of all, you want to think about, is hospitalization the right step? Speak to your loved one's doctor and discuss what options are available, what would be appropriate for your loved one. Could the procedure be done outpatient if possible, or could tests be done ahead of time to shorten the stay? Know if anesthesia is going to be used. General anesthesia can have a lot of side effects, so a local anesthesia might be a better option if that's possible. You want to talk to the doctor about that. And make sure that your loved one's regular medications are going to be continued. And if possible, can you get a private room? Will your insurance company cover it? Private room will be much calmer and less confusing for a person living with dementia. Involve your loved one in planning as much as possible. Do not talk about the hospital stay in front of them as if they weren't there. And shortly before leaving home, tell your loved one that they're going to be spending a short amount of time in the hospital. During the stay, this is going to be a very confusing and stressful time for the primary caregiver and for the person living with dementia. So talk to the doctor ahead of time and ask them to limit questions, especially for the person who has dementia. Like I said before, help staff understand they likely will have limited training on Alzheimer's and dementia. Make sure you have someone who can stay with your loved one to help keep them comfortable, and to help them if they need to use the bathroom or fill out meal requests or remember to drink water. They likely will have difficulty finding the call button or the bathroom or making adjustments. And communicate so that they will understand. Make sure you take things slow for them. Make sure you advocate for them too. Tell the doctor immediately if the person seems like their condition has worsened or something has changed dramatically, and ask friends or family members to keep others updated. A lot of times this will lead to more confusion. So take breaks when necessary, maybe switch out with other caregivers if possible so that you can get a break. All right, so now we're going to transition to talking about getting help. In most caregiving situations, friends and family are going to be the first person or the first people who are turned to and ask for help. If a caregiver feels like they have the support of other people, they can manage the burden of caregiving better themselves. A lot of times people do want to help, they're just unsure of how to help. So sometimes you need to be the one to ask for help. In a lot of cases, people may not be comfortable with talking to a person who has dementia. They might not know what to expect or how to act or how to talk to the person. So help them by explaining why the person acts the way that they do, and remind them that the dementia doesn't just affect a person's memory, but it also will affect their language and their behavior and other pieces of the person as well. Some community members might be able to look in after your loved one, check in on them throughout the day, maybe a neighbor or the mail person even. The pharmacist can help keep track of medications and prescriptions for you. Try to think of people who can help you and think outside of your close network of people too. Remember that no one's going to do things the same way that you do. So it's important to thank the person for their help and try not to criticize their work or their help, or that they'll be unlikely to help you in the future. Sometimes caregivers will get to a point where they need help from people outside of their home to care for their loved one. So they might consider having a homemaker who can help with chores such as laundry, cooking, and shopping. A home health aide who could help the person with dementia dress, bathe, eat, go to the bathroom. Might consider a sitter or a paid companion, so a person who would sit with your loved one and maybe will help with some light housekeeping or cooking. Some sitters may even be comfortable with doing the bathing. They could also help with socialization and doing activities with your loved one, maybe taking them for walks or going out in the community to, a senior fitness class or to another activity. Visiting nurses can also be sent out by home health agencies. They can watch the person for a change in status, help with changing catheters, or give shots. It can be expensive to have a nurse come to the home though, and Medicare will only pay for it in certain situations under strict guidelines. Most families will turn to this type of home care first, and it can be good for people who are unable to get out of the home due to illness. Will it provide supervision and personal care? A lot of times it doesn't provide a lot of socializing and activities as some other options. The one option that does offer a lot of socialization is adult day programs. They offer structured recreation for the person with dementia. Some programs might be specifically just for people living with dementia, but some might be for people with any kind of physical impairment as well. Adult day programs can be an important resource for families, can be beneficial for both the caregiver and the person with dementia. Attending an adult day program can give the caregiver and the person with dementia a break from each other. Both can benefit from spending time with friends and participating in activities that they enjoy. A person living with dementia would be reminded day in and day out of their new shortcomings. However, they can still enjoy music, laughing, talking with friends, and doing simple activities. Could make new friends in the program. And a lot of time the staff will report the person has regained some of their sense of humor, seems more relaxed, and is enjoying the activities. One thing that tends to hold families back from attending these programs is transportation. It can be a barrier for families as well as for the programs themselves, as it can be time consuming and expensive. Some programs are able to provide transportation themselves, while others will contract that out. Either way, ensure that your loved one, if they are going to be using transportation, make sure they will receive the proper supervision on the trip. And in a lot of situations, families will look at adult day programs as a last resort. However, it can be beneficial for the person to start attending sooner. This allows them to adjust to the program and enjoy some of the activities that while they're able to. And it also gives the caregiver a break earlier before they reach that point where they're burnt out. Short stay residential care is something that most people are not familiar with. It's when the person with dementia goes into a nursing home or assisted living or boarding home for a few days, a week, or even a few weeks. This time is usually used by the caregiver to take a break, go on vacation, or receive medical care. Caregivers are usually excited about this option once they give it a try. Unfortunately, there isn't much funding available to help pay for the person take these breaks. Some caregivers are also worried that if they do take this kind of break, they might not be able to get back into the swing of things and commit to their caregiving duties once again full time. It can be helpful if the caregiver doesn't wait until they get to their breaking point before taking any kind of respite help. And because changing a person's living with dementia's environment can be really confusing for them, make sure the place that you bring them to has experience working with people living with dementia. If it's a home, make sure they have the staff available to help them if they become confused, and they can give them individualized attention as needed. Excuse me. A lot of times, families will state that they don't think their loved one would enjoy an adult day program or another person coming into their home to look after them. However, once the family does make the change, they can be surprised with the positive response their loved one has. However, if you ask your loved one, do you want to go to an adult day program? You'll likely be faced with a no. Your loved one may not understand what you're asking. In fact, some people will continue to say no even after they've been going and they've been enjoying themselves. It's important to realize there's going to be a period of adjustment. It can be hard to remember this as you're exhausted and you're ready for a break, to constantly have to talk your loved one into going to the program or having someone come over. So allow for a good trial, and oftentimes your loved one will accept the help over time. When talking about the new plan, think about how you'll present it to your loved one. Talk about how it is an activity that he or she will enjoy. When you're having a person come to the home and stay with your loved one, present it as a friend. Think of things that your loved one enjoys doing and the care provider can do with your loved one. When it comes to the day program, call it whatever your loved one will accept, such as the club or school or even work. Remember that each day your loved one goes to the day program or the care provider comes over, it's like starting over for them. Usually the routine does not start to catch on for them over time. Try to keep the visits either to the day program or with having the care provider come to the home consistent to allow for the routine to fall into place. Excuse me. When your loved one comes home from the day program, they may state that they were hit during the day or they weren't allowed anything to eat. Talk to the program staff about what was brought up to you. However, remember that people with dementia could often misunderstand or don't remember correctly what happened. It could possibly be that they don't remember having lunch. If they state they did nothing or they didn't have a good time, again, remember that they simply might not remember what they did that day. Don't continue to ask your loved one, as it may embarrass him. Talk to the staff directly about your loved one's day. These are some tips to help your loved one adjust. Make the first few visits short. See if you can go for a couple of hours, and maybe you can even stay with your loved one the first few times. If doing a day program, see if someone will visit your loved one from the day program at home first before the visit, so that will help make the transition a little bit easier if they have a friendly face. Okay, so now we're going to transition and talk about some long-term care options. A lot of times people will ask me, when is it the right time? How do I know that it's time for us to consider long-term care? And it's hard to say. Every family and every situation is different. There is no right time for placement. In some situations or in some families, there does come a time where you can no longer care for your loved one at home, even with help coming into the home. There's no right time for placement, and there's no one reason that people decide to take that step. In some families, the caregiver is worn out. When others, life demands make it more difficult to be a full-time caregiver, such as children or work. Common reason seems to be that the person with dementia needs more care than what the family is able to provide at home. Many families will try several different options before deciding on placement. It can be a very difficult decision to make. However, it may also be the most responsible decision you can make if the person needs more care than you're able to provide, or if you are unable to provide the care anymore. It can be helpful to talk to your loved one early about these decisions. Knowing a person's feelings on residential care and nursing homes can help make the decision easier. And families may feel guilty for having to place their loved one in a nursing home. However, they could also feel relieved that the decision has been made and the fact that someone else is taking on some of the caregiving responsibilities. At the same time, they might feel guilty for wanting somebody else to take over that care. It's very common to have mixed feelings over the placement. things to think about. So when it comes time to move the person you're caring for, it's important to talk to others on the care team or in your family. It is not unusual for family members to be on different pages when it comes time for this decision. Try to have a family meeting to discuss these topics. Having these meetings will help mitigate any misunderstandings and possibly reduce arguments. So at the meeting, you want to talk about why is it the best time for the person to move? What is the cost of care in the nursing home or residential home? And where is that money going to come from? Who's going to pay for it? What are the advantages and disadvantages of the facility you chose? And what changes will happen because of the placement? So some types of options you have include assisted living facilities. These will provide people with help for daily tasks, but they often won't provide nursing or medical care. People who live there need to be able to walk and participate in their own care. One appeal to families and the person living with dementia is this tends to be more of a home environment and less like a hospital feel like it can be in nursing homes. Assisted living facilities also tend to be less expensive, but there is no financial assistance from places like Medicaid. And a person could be discharged if he or she is no longer able to walk or starts to need more medical or nursing level care, or her behaviors are considered dangerous. There's also continuing care communities, which have a range of services from independent living to long-term care. Usually, as part of a basic package, a certain number of meals are provided per month. And as a person declines, he moves to a different part of the community to meet the level of care that he needs. In order to live in a community like this, people can expect to pay a monthly fee in addition to an initial down payment or an entrance fee. The independent living area could be set up as condos, and the resident would pay a monthly mortgage as well as a monthly condo fee to help with the maintenance of the building and the grounds. Some facilities will allow spouses to move in together, however, will not accept the person with dementia or may charge an initial higher down payment. When the couple or the person is accepted, the facility may provide care until they pass away, even if they run out of money. Before a person commits to a community, they should research it carefully and read the contracts. Once you have put your resources into a program, there isn't much you can do to change it. The community care communities closest to us are located in Rochester, Ithaca, and Shelburne, Vermont. This is according to the Commission of Rehabilitation Facilities and Continuing Care Accreditation Commission. It's a mouthful. However, there may be other communities out there that are not a part of this group and that I'm not aware of. Nursing homes, this is what people are most familiar with. They provide 24-hour supervision, 3 meals a day, assistance in ADLs, which are activities of daily living. They include eating, transporting, or walking, moving, getting around, bathing, dressing. Also provide nursing care and offer some rehabilitation services, including physical therapy, occupational therapy, and speech therapy. When it comes time to choosing a nursing home or really any type of long-term care facility, you need to ask yourself these questions and think about what's important to you. Do you want a place that has a special unit for dementia patients? Do you want it to be close to friends and family? Do you care a lot about what activities are being offered? Talk to others in the community and ask what places they suggest. Don't forget to ask your loved one's doctor for recommendations that they may have. Get in touch with some nursing homes that are on your list. Ask questions, including how many people live there, the cost, and if there's a waiting list. Excuse me, meet with the director and nursing director. Medicare nursing home checklist has a list of great questions and things to look for when you're visiting. So if anyone is interested in that checklist, I would be happy to get you a copy of that. It has a great just list of questions and things to look for. When you're visiting, ask a lot of questions, see how long the key people have been there, including the director, the nursing director, the head person for food, the social worker. It can be a bad sign if a facility has a very high turnover rate, especially when it comes to those key people. Visit again, and maybe this time don't call ahead. Aim for another time of day. You could meet other staff this way, see what activities are happening. Think about stopping in at a mealtime to see what that's like. And make sure you fully read the contract. If you don't understand something within the contract, it might be a good idea to have a friend or a family member read it too, to make sure you're not misreading something, misunderstanding, you're not missing anything important. It can be important to, if there are wait lists, you can join the wait list. And if it's not the right time, when your name comes up to the top of the wait list, that's okay. You can turn it down. So that is one option. Hospice and palliative care. So when a person's in palliative care, they can receive comfort care for their symptoms, as well as treatments to help cure the disease. They have a consultation team that would include doctors, social workers, nutritionists, other healthcare providers. Can be done in hospitals, nursing homes, outpatient clinics, or at homes. And Medicare, Medicaid, and the VA and private insurances may cover palliative care. You need to talk to them about what they cover and make sure that your situation would be covered. If over time doctors determine treatment isn't working for you, or you could transition to hospice if you would like, and if you meet the criteria for hospice, or you could continue on palliative care with the primary focus being on comfort care. And this can really improve the person's quality of life. Hospice care, again, can be provided in any setting. It happens when the patient no longer wants treatment or it's not possible to cure an illness. It provides comfort care. It's for people whose doctors believe they have 6 months or less to live. It does not mean stopping all treatment, and it doesn't have to be permanent. A lot of times, the majority of this care is provided by family and friends. All right, so the other thing we haven't talked about is paying for care. So we have all of these wonderful options. How are you going to pay for it? Paying out of pocket is one option. Older adults may pay out of pocket for adult day programs, meals, or other community services. These community-based services can help them stay in their homes for longer. Usually, assisted living facilities, continuing care, retirement communities are paid for out of pocket as well. In some states, Medicaid may help pay for the cost, but that really depends. Medicare, so this is what people 65 age or older have, or if people are in late stage kidney failure, they're receiving Social Security disability income for more than 24 months, and they qualify for Medicare as well. There's different parts, but no personal care is covered at home. We'll pay for hospital visits, doctor's visits, and some medication costs. Medicaid, this is the federal and state program for people with low income, it covers medical care, and it can cover long-term care. Eligibility and services vary from state to state, and there are some changes coming to Medicaid. So there is something called Community Medicaid in New York State, which helps pay for in-home care services. And previously that did not have a look back period. However, there are changes, and I don't know the specific date off the top of my head, but there is going to be a look back period coming, and that's what we had the Herzog Law Firm on previously talking to us about. There's also something called PACE. In order to receive PACE, you have to be living in a certain service area. So in New York, it's Buffalo, Rochester, Albany, Syracuse, and New York City. So maybe if you're in our southern region, you're closer to Albany, this might be something you want to consider. The VA will pay for a lot of services for veterans and spouses of veterans. So check with the local VA if you qualify for that. They may provide long-term care or at-home care. Sometimes there is a waiting list, so it's something you definitely want to check on. Social Security disability income. So it's for people under the age of 65, and they have what they call a compassionate care allowance to help people with Alzheimer's, like early onset Alzheimer's or other dementias or other serious medical conditions, get disability benefits faster. They would need to meet the following criteria: be unable to work, have a condition that will last a year at least, or and be expected to result in death. Long-term care insurance. So this would really vary depending on the type of policy that you have. There are nursing home only coverage policies that would include care facilities as well. The costs increase as you age, as well as your health declines. So a person who is in poor health or already receiving end-of-life services would not typically be eligible for long-term care insurance. If that is something you're considering, especially for yourself or maybe something you already have, make sure you shop around and compare policies before choosing one. Sometimes people will look into reverse mortgages. So this would allow the homeowner to take a part of what they own on their home and get cash for it. It would not need to be repaid until the home sells. There's no income or medical requirements, and it's tax-free, but the existing mortgage does have to be paid first with the reverse mortgage funds, and you need to be at least 62 years old or older. So life insurance. Some policies will have a life insurance piece and a long-term care piece. And maybe you can get an accelerated death benefit if your policy has it. This allows you to get cash advances while you're still alive. When you do this, the amount you withdraw is taken from the amount that your beneficiaries would receive when you pass away. You can be eligible for an accelerated death benefit if you are permanently in a nursing home, need long-term care, are terminally ill, or you have a life-threatening diagnosis. You can also try to sell your life insurance policy for its current value or take a life settlement. This is for people who are over the age of 70 years. And the income from that sale is taxed, but can be used for anything. And a viatical settlement, it lets a person who is terminally ill sell his life insurance policy to the insurance company for a percentage of the death benefit. This is usually for people who are expected to live 2 years or less and can be difficult to get. Annuities and trusts. So a person may choose to enter contract with an annuity company. In this case, a person would make payments to that company. The money stays with the company and the person collects interest. Then at a certain point, either when the person asks or when an agreed upon amount of time has passed, the payments begin to get made back to the person. A trust, on the other hand, is when a person transfers their assets to another person in a legal document. That person will become the trustee and now manages and controls the assets for the person. There are two types of trusts that can be used to help pay for long-term care services. It's a charitable remainder trust and a Medicaid disability trust. And that's what I was talking about before about on Medicaid, where there is going to be a look back period for community Medicaid of 2.5 years. So if that's something you think you may need in the future, you want to talk to a lawyer now to get that set up before that look back period goes into effect, or when it's soon enough in plan ahead so that you have time to take that into account. That brings me to the end of my presentation. Let's see if anyone has any questions, please type them into the chat box. I do want to say, I always give books out with my presentations. The book that I normally give with this presentation is the 36-Hour Day. This is, they call it the gold standard for dementia care. It's a wonderful book. My copy is, it's a little big. It's the large print version though. And the nice thing about all of the books I give out really is that there's an index. So you can look for the section on planning for future care or paying for care or picking a nursing home. You don't have to read the whole thing cover to cover. So if anyone would like a copy of this book, please let me know. I'd be happy to drop it off if you're local or mail you a copy if you live further away. And yeah, just let me know. I'm happy to get that to you. The other thing, this is my last presentation in my series that's been happening Monday evenings, but we are starting another training. It's going to be on Tuesday afternoons, starting on October 12th. And it is the Powerful Tools for Caregiver training. It is, like I said, a 6-week virtual training. It's designed to help caregivers reduce stress, locate helpful resources, improve communication skills, set goals. It's a great training. It's evidence-based to really reduce stress, which is the number one thing. So if you are interested in signing up for that, please let me know. I see there are some questions. Okay, so if you are interested in getting a copy of the book, please send and you're not in our organization or not in our service area, just send me an email with your address so I can get that to you. And what is the difference between an irrevocable trust and the ones that you mentioned? So yes, there are irrevocable trusts. There's many different types of trusts. And that is a great question and one that I am not positive of the answer to. That's why I always recommend people talk to elder care attorneys. And we did have some presentations with Herzog Law Firm a couple weeks ago. So they're definitely the people, they're the experts in that field. I am not an expert, especially when it comes to the legal jargon. I'm sure there is a difference. I don't feel comfortable saying that. And yes, and I see a couple other people would like a copy of the book. Yes, I can definitely get that to you. Are there any other questions? If you think of anything after the fact, please get in touch with me. You can call our 800 number or you can call me directly. My number is 518-564-2049. I'm always happy to chat and answer questions. And I hope to see you all again at another upcoming event. Thank you all, everyone. Take care.